China has indulged in an all-out people's war to tame the new coronavirus outbreak. More than 760 million people have been quarantined now, which implies that nearly 10% of the world's population is under a stringent lockdown, and that is more than half of China. Villages and cities are flooded. Battalions of uniformed volunteers and political representatives are carrying out the biggest social control campaign in history, for a singular goal, which is to keep millions of people away from each other. China is in a wartime battle with the coronavirus pandemic. To tame the deadly outbreak, a Mao-style social control has blanketed China. Residential lockdowns of varying strictness from checkpoints at building entrances and on the streets have quarantined more than half of the country's population, summing up to 760 million. Yes, you heard that right. That is 10% of the world's population, which has been put under an infinite quarantine period. Many public places are in a virtual freeze. China, Beijing's prevention efforts have been led by its myriad neighborhood communities. Government's grid management system is keeping a close watch and a tighter grip of the Chinese population. The authorities are combining enormous manpower with mobile technology to track people who may have been exposed to the new virus. From moderate to severe, China has imposed different policies varying from city to city for fending off the epidemic. But has China's quarantine strategy been able to contain the outbreak? The new coronavirus has already claimed 1,665 lives, with nearly 69,000 people battling the infection. Are the overbearing measures of China backfiring? Is China scaring the infected people into hiding and making the outbreak even harder to control? The outbreak in China has led to a huge demand for masks and a consequent shortage in the markets. In order to bridge this gap, diaper-making units in China are now shifting to mask making. Take a look at this.
我总共从研发到设计出纸用上5天时间就出来了，其中有2天到最后的公关的时候，就是基本要出一个流程图，啊，这流程图一出来，基本方向就有了。
And here's another story of hope, the story of a man who propped up a whole production line of sterilized equipment single-handedly in the midst of the coronavirus outbreak in China.
初二打电话给我说，现在武汉那边疫情爆发得很严重。医院里面急需要这种消毒设备。打电话给工人了，但是他们那时候已经村上就已经不允许出来了。从编程啊、刀具啊、从加工调试啊，我都会弄，所以先顶着吧。总共加起来睡到2个多小时，这辛苦总比疫情夺去人的生命要好对吧？
the 30th of January, the World Health Organization declared the outbreak of the new coronavirus as a public health emergency of international concern. And today, the death toll stands at over 1,600, with nearly 69,000 infected in mainland China alone. COVID-19, as the World Health Organization has named it, is already far more deadlier than the SARS outbreak of the early 2000s. Since then, the international body has issued many advisories for countries dealing with the outbreak and its containment, and the following steps are key in any country which wants to avoid catching this outbreak. The WHO issued an advisory for the countries that are repatriating their nationals from Wuhan in Hubei province of China and asked for the following key considerations to be made in order to ensure the health and well-being of those involved in the repatriation. The organization has firstly advised advanced bilateral communication, coordination and planning with the Chinese administration. The advisory also says that the aircraft should be properly staffed with sufficient medical personnel to respond to illness en route. Initial screening by measuring temperature, overall wellness and a questionnaire should be conducted with each passenger. Those initial screening results should be shared with the receiving country. The travel of those who are suspected patients should be delayed and separate from that of seemingly healthy passengers. The World Health Organization has also issued guidelines for suspected cases detected upon arrival. Trained personnel should be available for early detection and initial evaluation at the receiving airport. A separate pathway should be created to rapidly refer suspected cases to the designated hospital. A functional public health emergency contingency plan at the point of entry should be in place. Immediate disinfection of the aircraft should be done. Now, the World Health Organization has also issued an advisory for the quarantine of patients. The quarantine space should minimize risk of potential transmission. Patients should be provided with adequate food and water, protective gear for medical staff, and patients should be made available. No entry for family and well-wishers to maintain safety. There must be protective garbage disposal. Patients must also be treated with respect for the dignity, human rights and fundamental freedoms. Quarantine may be extended past 2 weeks based on the treatment required. The WHO advisory for health workers says only trained personnel should be assigned for treatment of the infected. Every health personnel must be equipped with the basic protective gear like masks, gowns, gloves, face shields and goggles. Hand sanitizers and disinfectants must be regularly used. Active surveillance must be done to identify suspected cases. Personnel responsible for administrative work and cleaning services should be trained and protected as well.